Hi, my name is Reina Lombardi, and I'm an art therapist and mental health counselor, and I own Florida Art Therapy Services. And we've decided to bring you this series of conversations with the therapists that work at the practice. And we've titled it Expressions and Reflections, which we feel captures a lot of the work that we do with clients, helping them to express themselves more freely and um, connect with what's going on within themselves and find other ways to um, bring about meaning without words. Sometimes that's imagery. Obviously, using art, we use a lot of imagery, but it could be sculptural, it could be musical, it could be movement. And then, of course, the other part of that is reflecting upon that like once we're creating something, the important part of the meaning making comes back to reflecting upon that experience. Without further ado, here's our conversation. We're going to have a conversation about anxiety today. But before we go into talking about anxiety and how we can help people to manage the anxiety that they experience more effectively so that it's not impacting their functioning, um, just share a little bit about who you are and your background.
Alrighty. I'm Colleen. I'm an LCSW and a qualified supervisor. I have been in this field for over 10 years now, worked in a variety of community grassroots service organizations, as well as within the hospital and in private practice. Um, and I just really enjoy helping people to understand how their habits have formed and how they can change their habits to better fit their needs now.
Hmm. That's an interesting perspective, how to change your habits to better fit your needs. Um, yeah. So let's talk about how um, our anxiety response to things in life can become a habit, right? Sometimes we don't think about emotions as being a habit, but I think that they can be.
Absolutely. I really feel like, especially reactions like anger, fear, anxiousness, depression, those um, usually all served us at one point in our life, whether it was through a crisis we were dealing with or through just being able to focus in and get some things done, or to cope with an environment that was totally out of our control. But then they tend to grow into these little monsters, and you have this anxiety monster that just controls every aspect of your being.
Mm,
Um, and it's no longer serving that. Either the crisis is ended or you've changed the environment, but the anxiety is still there and it's still dictating heavily how you respond to things, how you think about things, and how you feel in general.
mhm. Yeah, it can be a very powerful voice in terms of like the inner voice that we all hear and experience as the self-talk. um, that anxious voice can feel really really loud sometimes and very dominating and bossy. um, how do you help people to start to become more aware of that voice when it's speaking?
I think one of the biggest ways is helping people go back and understand when that started and when it became useful to them.
Mm,
If you're in an environment where you're under physical threat or emotional threat, the heightened anxiety response lets you navigate potential potholes better. Oh, I'm anxious and I'm hyper aware of what's going on around me, and therefore I can avoid, oh, this person looks not safe right now. Let me shift over here, or I'm gonna back off, to not get into situations or make situations worse. So finding out where that response started building,
Mhm.
um, and then also at the same time going over just noticing, doing body checks. What does my heart rate feel like? Do I feel flushed right now? Do I feel like my pulse is racing, or I'm sweating, or my stomach is in knots? And just noticing those moments throughout the day when your body is giving you that anxiety response at more of like a level one, instead of, oh my gosh, I'm in a fully fledged panic attack. I can't breathe. I can't function.
Mhm.
So just helping people notice it, both where it's stemming from and when it's at a low level where it's much more manageable and can be brought back down.
Yeah, I think that the working with the body recognition is such an important piece because all of our emotions start as a sensation. Our body, our five senses pick something up, and that, triggers the response of like, okay, now I'm feeling a certain feeling. But it could be even an imagined, right? Like we can imagine ourselves into a sensation or a feeling too. It doesn't have to be like really happening right now. But it's that sensory response. So helping people to really connect with their body, of what's going on in their body and the subtle changes, that the body is telling us stuff all the time if we're willing to listen to the body.
Absolutely. And it seems, at least from my experience, to be pretty consistent. Your
Mm,
body reacts similarly. Everyone's body reacts differently, but within your own body, you tend to be fairly consistent. Your autonomic nervous system responses in each person tend to follow the same pattern.
mhm,
So if you can start noticing that first moment when it's starting to get triggered and what that feels like within your body and your mind, you have a lot more control over where it goes next.
mhm, mhm. And so, what do you think are some helpful tools for people when they do start to notice, oh my gosh, I'm really starting to feel elevated here? What should they do then?
Um, Everyone's system responds differently, but I found a few things that tend to work really well for most people are patterned breathing. Breathe
Mhm,
in 4, hold 2, breathe out 6, hold 2. And just forcing your breath into almost a sleep pattern of breathing triggers your nervous system to start calming back down. Um,
mhm,
I found for some people, sensory input.
mhm,
What can I touch right now? What can I smell right now? What can I hear right now? What can I see? Helps bring you back into your immediate moment.
mhm,
Um, and I've recently been experimenting more, with another professional on, yoga and balance based. It's really
mm.
hard to be very anxious or to be in a panicked mode if you're doing something physiologically difficult, like stand on one foot with your eyes closed,
Oh,
or Mhm, because you're concentrating on not falling down, so you don't have time to engage in anxiety. You have to
interesting.
manage your body.
I, th- in my mind, just went, but what if you start to worry about falling down?
You do worry about falling down a little bit,
But
but it cuts you off from everything else.
that's different from the other worry. I gotcha. Yeah. That's really interesting. That's something new. Like I hadn't learned that before. And certainly, like in yoga, it's all about the breath, right? And
Breath. Mhm.
really having a lot of control of your breath and really being present in the body,
Mhm.
and noticing all of the things that are going on within the body. Um, so that focus, that level of mindfulness, um, I think can be helpful.
Yeah. It helps eliminate the option for the anxiety to continue. If
Mm,
you're really focused in the moment, you're really being focused in your body and on being connected within, your mental and physical self.
mhm.
You don't have that almost closes the door. We can't move into anxiety right this moment because we can only process so many things at once. So if you kind of if you stretch that capacity to process information, I'm paying attention to my breathing. I'm paying attention to my physical body and space. I'm paying attention to how my mind and body are connecting. It's a lot of things to think about. It doesn't leave much room
Yeah,
for anxiety.
right. It it helps you get out of your head and drop down into the body, um, and be more present in the now, right? And
Yeah.
I always think about anxiety as like anxiety is the absence of presence because the mind is in the past trying to repair a problem that occurred there that's has no longer has control over, or it's so far out into the future, like creating these catastrophes that are highly unlikely. And so, in both cases, we're not really present with ourselves. We're not present in our environment. We're not present with the people in our lives. Um, it's like we can feel the sensation of the anxiety in the body, but it's really about how the brain is like processing all of the thoughts. um, what are some of the things that in your work with clients, how they describe how what's going on for them when they're feeling anxious?
Um, and that can be different for most people. Some people say, "Oh, it just feels a little fluttery in my heart, but then I can't focus." Whereas I've seen a few people who've gone to an extreme of I felt like an elephant was on my chest and I wanted to scream, but no sound would come out, and I couldn't talk to anyone, and I was locked inside my body.
Mm,
Um, and I think the thing to remember with that is neither response is less valid than the other.
mhm.
Both, the people who only felt the mild physical symptoms were not necessarily less anxious than the people who can't speak or breathe,
Right.
or is their experience less valid or less in need of intervention.
Mhm.
But having it, knowing what your response is and that it's not serving your life well in this moment is really the threshold.
Right. When I heard you talk about like somebody describing it as like an elephant sitting on your chest, certainly you can't breathe, right? Or breathing is extremely labored and difficult. You're describing a specific like a neurophysiological state, which is part of our right fight, flight, freeze, fawn, state of survival, and how anxiety can create this extreme response even when a real present threat doesn't exist, but there's some kind of association that's occurred, right? That paired association, which you were talking about. Can we go back to when this you first noticed this? Like, what's that patterning that got stuck that's creating that response? And for some people, it might be something minor, or maybe it's like a pattern that evolved in a relationship dynamic over time. for other people, there's some kind of traumatic incident that they have survived, and that physiological response was helpful to get them through it. But now the body keeps wanting to go there because it worked.
Mhm.
Right. It's just interesting how like everybody's body does something different, but the purpose and the function is all the same.
Absolutely. It usually stems back to a survival moment or a
Yeah.
threat of some kind.
Yeah, definitely. Um, Things that we feel anxious when we feel, threatened or insecure about something uncertain. And certainly with, um, people who have experienced some, significant traumatic event, whether it's a big T or a little T, like the symptoms in response is, feeling a little bit anxious about life because can't really trust. Am I going to be safe, or is this really going to be a safe situation or a safe person or what have you? Um, oh, go ahead.
Well, I was going to say the trust thing kind of brought something up for me. Um, I feel like a lot of people who suffer from anxiety, there is that lack of trust. And a lot of times it might have started with an outside event, but it becomes lack of trust in me. I don't trust me. And helping people to develop that self worth of, no, I am paying attention to what's around me in a healthy manner. I am, you know, managing my environment in a safe way. I am making good choices. That can also really help lower anxiety, just trusting yourself again.
Mm, that's such a good point. Um, I I hadn't really thought about it like that, and all my years doing this work, that it goes back to a sense of, not trusting yourself, but it's there, right? It's obvious now that you're speaking it out loud that that is part of it, right? Can I trust myself in this situation? Can I trust myself to make good decisions about, who's safe to be around or who's not? Right? All of those things. Um, so not just a lack of trust in the outer environment, but a lack of trust in the inner environment too. So, what are some ways that you help people start to um, really connect back into trusting themselves again and like learning to trust themselves again?
Um, I think the biggest thing, the starting point of anything really with therapy goes back to giving yourself a little bit of grace and a little bit of credit, not expecting that immediate perfection. No, therapy is kind of a dance. It goes forward sometimes, it goes backwards sometimes it's sideways, and you got to bring it back. Anytime you're digging into life patterns and changing them, it's not going to be a straight line. And it's definitely not a point A to point B. And we're here and are better now. There's so much in between. So I think just the very core of it is helping people to realize you've taken a step even showing up.
Hmm.
You've taken a step in even considering new information that's being provided to you or new information you're realizing about yourself. So give yourself credit for those little steps because those little steps are how it all builds.
Hmm.
And
Hmm.
that's where the momentum comes from.
Yeah. So, just really acknowledging that courage to show up for oneself, which I think committing to therapy is truly a courageous thing. Um, it is incredibly vulnerable,
Yes.
right?
Yeah.
um,
Especially for someone who's already anxious and uneasy about the world. Now I'm stepping into this stranger space and revealing all of my vulnerabilities and everything I feel like is wrong, and
hmm,
trusting that that's going to get me to a better place.
yeah, yeah, that takes a tremendous amount of courage and strength, inner strength, to be willing to that willingness to do that. And so capitalizing on that and providing some acknowledgement and reinforcement and helping them to reinforce that for themselves.
Absolutely.
Yeah.
And then it does slowly get bigger into things like really thinking through day-to-day decisions. Well, why do I do this? Do I do this because I want to? Or am I doing this because I am trying to avoid something negative that I think may happen? Or
Mm,
am I doing this because this is what I was conditioned to do by somebody else, but I don't care about it at all?
mhm,
So just really digging into why you're doing what you're doing
mhm.
to determine if it's something you want to continue doing.
Mm, yeah, I like that. That's an important, those are important questions for everyone to ask, regardless of whether they're feeling anxious or not, right? Like, what's your motive for the choice in your life? Is it really because it's something that is aligned with your personal values and beliefs and what you want for yourself? Because when we make choices that don't align up with that, oh, we don't feel very good. Like, and it might be a subconscious, like a lack of awareness underneath the surface of like, I can't pinpoint why I feel so bad. I can't pinpoint like what, what's so irritating about this for me. But, the way you kind of phrased it, like, is it conditioning from somebody else where there were these expectations that you had to live up to? Or, are you doing it out of fear, a fear response? Like, are you avoiding it or are you just powering through it? Also out of fear, but, not really allowing yourself to feel comfortable while going through. Interesting perspective. So, if somebody was interested in working with you, to work on, you know, feeling more confident, learning skills to help them to avoid avoiding. Um, that's my favorite phrase to tell people you got to avoid avoiding. Um, that's usually a sign. Uh, what would be something that you would want them to know about what it would be like to work with you?
Um, I am the quintessential social worker. I chose social work because it aligned with who I am as a person.
Mm,
Um, and one of the core parts of social work is being with people where they are in that moment. And I think that's one of the most important things for me to provide is just being able to be with a person who comes in the door where they are that moment,
mhm,
not where they were 10 years ago, not where they want to be 10 weeks from now, but what's going on right now and what do you want to shape it like?
mm,
So I think it's so easy, especially in our current world. There's Zoom meetings and there's career changes and there's work at home or work in groups or don't go to groups or don't be around other people or always be around other people. There's so much pressure. And our world has gone from a local situation to almost global. I can talk to someone in China if I want to.
mhm,
I can, I can make a trip around the world in less than a week now if I so chose. And just bringing that back to, okay, well, we have all of these options, but what do you want this life to look like?
mhm. Yeah, that's it's such a powerful question. And sometimes it's also one that's really, really hard to answer. And it takes a while to kind of work through and sort out. But it's totally worth doing.
Yeah.
I think the other thing that, in thinking about what you were saying, is how fast paced life is and how if you're really sitting with somebody and being with them in the moment where they are on that day, at that minute, that you're really honoring the space of slowing down and being fully present with somebody, which is a gift, I think. Um, yeah.
Thank you.
Welcome. You're welcome. So, if anybody who's watching, if you have any questions about any of the content that we talked about today, feel free to hop on the website, www.floridaarttherapyservices.com. You can send a message there and it will come through and we will answer you. If you're interested in, working with Colleen, um, give the office a call, 239-297-7099, and ask specifically to work with her. And I'm sure she'd be happy to support you in figuring out what that life is that you want for yourself. Um, do you have any final words, Colleen?
Um, just thank you so much for taking this time with me today. This has been a great experience, and I hope somebody hears something that connects with them and can help bring them a little more comfort and joy in life.
I hope so too. I hope so too. All right.
All right.